Good morning, everybody. I am sorry I am late. I had technical issues. Of course, it's my first stream. My name is Sarah. Welcome to Nerd Mom 72. 72 because I'm showing my age. So, the first thing I want to do is shout out my envoy. So, well, in America we say envoy. I say envoy because my envoy is from Nigeria. So, if you want a professional envoy who sets up your campaign, where on my Twitch you will see my logo, my banner, my intro. I have so much more that she did for me that I haven't had a chance to put up yet. And she is amazing. Her name is Myra. You can find her at Myra_digital or on Instagram at Myra_digital1. She is amazing. She's young. She's full of energy. She goes above and beyond. I am absolutely thrilled with what she did for me. And she's fast. And she will listen to you, which I absolutely loved. I enjoy working with her. I am so looking forward to continue working with her. So, that's that. I didn't have to do this plug. I offered to do this plug. Again, Maya_digital. I cannot recommend her enough. I'm going to plug her on each screen. I don't care. She said I didn't have to. I'm doing it anyway. So, we are talking about lupus and other chronic illnesses because lupus hardly ever is by itself. If you have lupus, you probably already know this. I myself was diagnosed with lupus when I was 28. If you watched my first really rough stream, I mentioned that there. I was diagnosed, I really didn't have, well, I did have symptoms, but I didn't realize I had symptoms. I was very tired, but I was very busy, so I didn't realize it was a symptom. I was tired. I worked a lot. I was 28. I was busy. That was my excuse. I'm busy. I don't know. But I was having some pain in my knees and my hips. I was falling a lot. And then I found out that I needed a double hip replacement, which for somebody that's 28 years old, that was very daunting. It was very scary. I can honestly tell you I was terrified. Having that kind of surgery at 28 years old is almost unheard of if it's not due to trauma. So that was my intro to lupus. Yay. So what I want to do on this channel, and I want people to understand that this is not just for patients, this is also for caregivers. So I know how hard it is to be a caregiver. I was also a caregiver for a very long time. My husband died many years ago. He actually died a year after I was diagnosed. I was 29. So I know what it's like. He had horrible sleep apnea, many surgeries. So I feel like I didn't sleep for a few years back then because I was constantly watching him. So caregiving can be really, really hard, and I understand that. So this is a very safe space. I have my tea. My tea is very hot right now. So I have my tea. I also have water because one thing we have to do is stay hydrated all the time. I know it's exhausting. Drinking water shouldn't be this hard. It's hard. It's very hard sometimes. Sometimes sometimes I drink IV water just for the extra, because sometimes we need a little extra. But anyway, this is going to be a place where you can come and be heard as a patient, as a caregiver, as somebody that just maybe is interested in knowing about lupus, because I myself didn't know a lot about lupus. I had to do a lot of research, and I was surprised to find out that there's different kinds of lupus. There wasn't a lot known about lupus. Things have changed since 2001. Not much as far as medicine-wise, which is kind of a shock to me, but we'll get into that. We'll discuss all that stuff. Again, my channel is not just my channel, and that's something I want to make very clear. It's for you guys, for everybody. I'm here as an informer, as somebody that if you have questions, you are more than welcome. Join the chat. Please join the chat. Ask me anything. If I don't have the answer, I have books. I will research. If you don't feel comfortable in the chat, that's fine. I have a separate email for this. It is nerdmom72@gmail.com. Send me an email with a question. I will answer you. I promise. I check my emails every day. I will get back to you as soon as I can. I am going to be very dedicated to this. You will be my priority. I want everybody to know that you will be heard here. I know what it's like to feel like you're not being heard and not understood. I spent a long time staring out the window, feeling like I'm the only one. So I get it. I want you to know that I get it. And you can cry here, and you can yell here, and you will not be judged. So, safe space. Bring your tea. I'll be here with open arms. So, first, let's talk about lupus. What is it? Besides a horrible disease that never goes away because it's chronic. Not the good chronic. Anyway, so yeah, I took notes because I tend to get off topic. So if you see me looking down, it's because I'm reading. So, as we know, lupus is an autoimmune disease, and auto is a Greek word meaning self, auto, and immune refers to the body. So, the body's immune system, which protects the body from illness. Okay, so if we have an autoimmune disease, it means that the immune system does the opposite. It attacks the body rather. I can't read my own writing. So, it attacks the body, which in most cases with lupus, our immune system gets very depleted. We contract a cold, so usually a normal person, and I say normal person, right? Because Lord knows we are not normal. A normal person gets a cold, they have a cold for a few days. A person with lupus or a chronic illness that has to do with their autoimmune system can get a cold, and within 3 days they have an upper respiratory infection. That's not a cold. Okay? That's not a runny nose. That's an infection. We are prone to get infections. And sometimes those infections can become very serious. We need to pay attention to our bodies. Listen to what your body is telling you. If something seems off, it's because it probably is. So that's one of the things I really want to drive home is you have to listen to your body. Okay? I know it's hard sometimes because if you're like me, something always hurts. And if you feel another pain, you're just like, oh, it's no big deal. It's just another joint, or, I get gastral stuff, so it's like, oh, my stomach hurts, no big deal. Well, let me tell you, you need to pay attention because I had a stomach ache for a few days and didn't think much of it. And this was a few years ago. And come to find out, I had internal bleeding. Not to scare anybody, but you just need to pay attention. It's your body just attacks you. And it's hard to recognize sometimes what's what. Especially as you get older. For me, is it regular arthritis? Is it rheumatoid arthritis? The blood work constantly. Like, how do I have any blood left? Because it's a constant. Every 2 months, I'm getting 12 vials of blood taken from me. But it's just to stay on top of the disease because you have to. An invisible disease can also be a silent killer if you don't stay on top of it. I have friends that have died. I have friends that are dying. I have friends that have no symptoms. My good friend has discoid lupus. And, she just has the butterfly rash and some joint pain. I won't say she got off easy. But, there's some famous people out there that have lupus. Seal, he has discoid. Selena Gomez, whom I love, she's adorable. She has lupus. It's affected her. I mean, we've seen her weight go up and down. That's due to steroids. I hate steroids. Hate steroids. But they do a number on your body. They really do. I gained 80 pounds. That's hard weight to get off, but I'm working on it. I am in a wheelchair. So losing weight is really hard when you're in a wheelchair. I'm in a wheelchair. My electric wheelchair. Zoom, zoom. Her name is Aggie. I name everything. All of my my helpers. So my electric wheelchair is Aggie. I have a cane named Lucy and another cane named Jojo. One's pink, one's purple. I know it's goofy, but I had to use canes when I was younger and my kids were young. So for them, it was fun to name stuff because I could just go to one of my kids, hey, go get Lucy for me. And to them, it was fun. So if you have young kids and you're having a bad day, you can make stuff into a game for them. That's what I did. Everything was a game. Cleaning was a game. Let's play cleanup. Everything was a game. So, and here I go off topic again. This is why I have to take notes. Anyway, back to what lupus is. We went through the autoimmune and what autoimmune means. I have this huge book. Huge. Heavy. I tend to swear. I'm Irish. Sorry. So, I want to just read a few things out of this book for right now. Because I find it very interesting. I love to do research. I wanted to be a research librarian when I was a kid. And I was like, ooh, that's a lot of school. But I ended up getting my degrees anyway in criminal justice and English. Because I love to read as well. So anyway, the first chapter in this book is what is lupus and how is it diagnosed? Now, this book was written by doctors. So this first part was written by Dr. Ian N. Bruce. So lupus, the Latin word for wolf, was first used to refer to a disease in 959 CE by the Catholic Bishop of Leodicum, today known as Liège, Belgium. He allegedly wrote in an affidavit, Ego reculus morbo qui lupus dictutor. My Latin is mena, gravitur atrius and fur and murium dictotus. This is translated as I, Reculus, being gravely affected and nearly taken to death by the disease called lupus. A later text, approximately 12th century, called the Miraculi Vitae Martini, or the Miracles of St. Martin, states the Bishop of Leodicum. Why do they come up with these names? By name, troubled with a disease that is popularly called lupus. So severely was the strength of the illness, raging, consuming, nibbling away at, devouring the man's flesh. The deeply rooted disease, though sometimes feeding on the outside, nevertheless was consuming his internal matter. This account speaks to two understandings of lupus as a disease that causes skin damage, devouring the man's flesh, and a disease that might attack the internal organs, consuming his internal matter. These problems are strikingly similar to the disease as we call systemic lupus erythematosus, which is what I have, SLE. This chapter describes lupus and how it is diagnosed. It is important to realize that lupus is not a cancer, such as breast cancer or leukemia, nor is it contagious, like chickenpox or the flu. A person with lupus cannot spread it to another person. People panic. When I was first diagnosed, oh my gosh, people were I wasn't freaking out. Well, I was a little freaking out, but not. It was just because it was new. And I had 5 young kids. Yes, 5. We're Irish. That's my excuse for everything. We're Irish. My kid's excuse for everything, too. I'm Irish. It is what it is. But yeah, it's not contagious. You can't give it to anybody. There's different kinds of lupus, discoid, SLE. There's a drug-induced lupus. They just came out with another lupus that I need to research. It's a neurological lupus. Not that they just came out with it. It's not like they're producing it. They just discovered a new lupus, I should say, that I'm going to do research on. It's a neurological lupus. There's a newborn lupus, too. I know way back, my grandmother called it cradle lupus. I do know from experience that it is genetic. My father is a carrier. My grandmother, my dad's mom, had rheumatoid arthritis, and they believed she had lupus. They didn't test for it back then. So it wasn't very popular, especially in the UK. My mother's mom was tested for it about 10 years before she died. And she died 9 years ago. Wow, 9 years ago. Yeah. And they tested her about a year before she died, and she was positive for lupus. But And if you have lupus, you know how the testing goes. You're negative, you're positive, you're negative, you're positive. So, yeah, she finally tested positive a year before she died. But she had rheumatoid crazy. Like her hands were gnarled and she had a really hard time towards the end of her life getting around. I have rheumatoid as well. My hands are starting to become hard to move, hard to work with, which I hate because I crochet and I knit and I play the piano and the violin and the guitar, and it's becoming difficult. I'm starting to enjoy hot soapy water and soaking my hands in it. It means I have to do dishes. It's alright. It's just me and my husband here. I'm an empty nester, so there's not a lot of dishes anymore. That's okay. Anyway. So there's different kinds of lupus. It is genetic. You'd be surprised how many people don't realize the genetic hops. So you might have lupus and you're like, but nobody else in my family has it. You'd be like, you could have a great aunt that had it. You don't know that she had it. Or an uncle, because men get it as well. My aunt has it. 2 of my kids have it. A little bit of guilt. My father, when I was diagnosed and they did genetic testing, wave of guilt came over him too, because they pinpointed it, through him. But you can't feel guilty about it. It is what it is, and you deal, and you do the best you can. And I want you to realize that you just do the best you can. Don't push yourself, because you're going to make it worse. You need to rest. You need to realize your limits. I'm not saying limit yourself, but you need to realize your limits. I found that out the hard way and lost my career over it. And I don't want to see that happen to anybody else. I worked and worked and worked and worked and worked. I loved my job, and I worked. And I was pushing 60 to 70 hours a week up until 3 years ago, where my body crashed. I mean, my body just crashed. And now I am unable to work. I get very tired very easily, so I rest when I can. I have decided to do this because I have a lot of time on my hands and I like to help people. I was an officer, security officer for a very long time. And then after I was able to get my degree, I was able to go into investigations, which I absolutely loved. I loved being a private investigator. I was a bondsman. I did warrants. I worked with the police department in Syracuse. I did a lot of stuff. I worked with New York State Police. I was a armed bodyguard. Oh my God, I loved my work. I met so many people. I worked for HBO. I just had a blast. I loved my job. I love my job to the point where it wasn't a job. And that's how you know you got it good. But I did too much between the travel and the hours. I just did way too much. And my body paid for it. And that was my fault, because I didn't listen to my body. And I knew better. So I guess I don't want that to happen to anybody else. I need to take an intermission for just a second. Oh, no, I don't. My dog, he's being goofy. I thought he had to go out. He's like, and then he got back up in his chair. Sorry about that. What a goof. He's a goof. That was funny. Okay, so let me get back to the book. So the other thing I want to talk about here before we get back to the book, I know the whole topic thing, it is what it is with me. I like to talk. You can ask anybody in my family. Nah. I want to talk about like medications and clinical trials and the stuff we can do to help other people, support groups, the Lupus Foundation, stuff like that. There's so much stuff out there now that wasn't before. I'm actually in a clinical trial right now for a medication that's supposed to help with fatigue. Wouldn't that be something? While I was doing research, I found that they came out with a new lupus medication, the first time in 50 years. I'm so excited. I'm actually going to call my rheumatologist this afternoon. That's how excited I am. I know, right? So, yeah, it is called Safnello. Safnello. Yeah. It's an infusion, but I can sit in an infusion center for a half hour once a month if it's going to make me feel better. I have absolutely no problem with that. Not at all. Okay, this is your channel too. So again, if you want to chat, you want to call in, I'm here. I mean, I don't know about call. But you know what I mean. We'll figure it out as we go along. Right? I'm new to this too. So. We'll figure it out. Yeah. I gotta see if my tea cooled down yet because it was really hot. Really, really hot. It's cooling down. Okay. So, I want to get back to the book just because this is a great book. I forgot to grab a highlighter. So, what do you got to look at? Ooh, I think a window. I'll be right back. Just gonna grab a highlighter. Ooh. Gotta take my headphones off. Zoom, zoom. Alright, so I decided I don't need the headphones on because I have some music playing in the background. Why not? Let's listen to it. I like rhythm and blues, so that's what's up. I went over and got my highlighters, and the TV is on YouTube. There's a big blow-up scene of me. Yeah, no. So, music is playing. I feel like my glasses leave too much of a glare. I hope not. I mean, I can not wear them and not be able to see if that's what we need to do. It's fine. like I said, we'll figure it out. I have a camera too. I'm new, like I said, so we'll figure it out as we go. I'm fine with that. Let me do some little adjusting. I feel like I'm always cutting the top of my head off. Okay. So, like I said, this is an excellent book for references. Well, referencing, I should say. I was writing my daughter's, well, okay, not writing it for her, helping her write her resume. So, okay. We got the whole immune disease, auto, and self, right? The Greek words. So, okay. Sorry, I got lost for a second. I'm marking my stuff. The other thing that lupus screws with, in case you didn't know, was memory. Yeah, I have to make lists and write everything down or forget it. Literally, forget it. So, the immune system, we have none. So you have to be really careful. So I've been home, right? Because I don't work anymore. So I've been home, literally, like, I've been, well, about 3 years, after the second wave of COVID. COVID was horrible for me. But, so, not this past Monday, but the Monday before, I had to go for this clinical trial and get all this kind of testing done. And it was at a rheumatology office where there were other people. Yeah. I was there for 2 hours. 2 days later, I had a cold. 2 days after that, I had the flu. I am just getting better. This is what they mean by no immune system. I literally have no immune system. I am very glary, it feels like. Well, now I can't see. So, it is what it is. Okay, so this is why I brought this up, because of lymph nodes. So, your lymph nodes, they're here. When you go to the doctor, they're always like, oh, and you're like, oh my God, don't choke me to death. It's because you have lymph nodes here, and under your arm. The lymph nodes, they're little ball-shaped. Okay? The armpits, the neck, the groin. Well, that's where leukocytes can travel. Alright? And that's where your white blood cells, or WBCs, which are leukocytes, they're lymph vessels that go into your lymph nodes. The body is amazing, but it's very complicated for the layman to understand. It's almost like you have to have a medical degree to understand what lupus is. Hence the book. I'm telling you. So the lymph nodes are a meeting place for immune cells to communicate with each other. Who would have thought? So when the body encounters infections, allergens, or anything else that stimulates the immune system, you may have noticed that your lymph nodes can swell, right? I have one swollen lymph node left over from when I was sick. I'm waiting for it to go down. Okay, So you get swollen glands. Those are your lymph nodes, swollen glands. So if you have strep throat, your tonsils in the back of the mouth, they call your lymph nodes to become swollen, I know I keep touching mine, I'll stop. So the lymph nodes fill up with your your white blood cells. That's what happens. That's why they get swollen. They fill. Because the white blood cells are attacking the bacteria. If you have strep, it's attacking the bacteria in your throat and the skin and intestines and spleen that are located in the upper part of your abdomen. And that's all really important parts of your immune system. So your white blood cells are like your bodyguards, right? They're so important. So your white blood cells are the ones that recognize that something is wrong. You know when you go to the doctor and they're like, well, let's get a white blood cell count. And your counts are like way off the chart. That means you have an infection somewhere. Something's going on, you know. Oh, sorry. I move my foot. So the white blood cells use molecules called antibodies against these invaders, such as, strep or, another virus or infection. Antibodies recognize chemical structures known as antigens on these invaders. There are millions of unique antigens for which the immune system must develop millions of unique antibodies in response. That's amazing to me and complicated. So our body, if you have, lupus or another autoimmune disease, doesn't work that way because our autoimmune system doesn't work the right way. So, because I'm going to try to explain this without sounding dumb. Because it's an autoimmune disease and our body attacks itself, instead of using the antigens, it's building up the white blood cells and white blood cells and white blood cells and white blood cells and not using the antigens to form the antibodies. The antigens are just there. It's not doing what it's supposed to do. So instead, you get this severe systemic inflammation. The inflammation can be the strep throat. So instead of the body fighting it off and throwing out the antigens, it's not doing that. The antigens aren't working because our white blood cells aren't doing what they're supposed to do. Hence, we get this infection. And I know, yes, a lot of people get strep throat. Of course they do. But just not as fast and severe as some people with lupus do. Hence the example. Okay. So it's immunodeficiency. Just our immune system is deficient, right? It just doesn't work correctly. And it's hard to say that because it doesn't mean you're not as much as somebody else or as good as somebody else. Because that's how you feel sometimes. You're just like, why can't I be like everybody else? And I understand the feeling. I do, because I felt that way. Especially when you're sick or you don't feel good or you have to have a surgery or... I understand. Because you just feel like, why is this happening? Sorry, I have to check my Discord because somebody is messaging me and I don't know if it's for this. Oh, it's May or Myra. I always want to call her Mayra because of the way she spelled her name. She's adorable. She's 25 years old. I want to adopt her. I have a 25-year-old son. So. She's cute. She's too cute. Sorry. I'm very proud. I'm proud of what I'm doing. I love helping people, and I hope this reaches people and helps people. I really do. That's all I want to do. That's all I've ever wanted to do is help people. Even before I was diagnosed, before all of this, I've always wanted to help people. It's a calling, I guess you could say. I don't know. Oh. Sorry. She's like, Mom, you look great. I love her. She calls me Mom. Yeah, we've crossed the professional line. It's fine. All right. So, if you have lupus, and I say if because the testing is pain. It's such a pain. Well, yeah, because it's blood work, constant. You get, like I said, the positive, the negative, the positive, the negative, and the ANA testing is just annoying. Just because you have a negative doesn't mean you don't have lupus. And it's discouraging when you're looking for answers, and sometimes you go years undiagnosed, and it's so frustrating. So frustrating. Please bring your frustration to me. I will help you. I will help you. I know what it's like. To be frustrated. And to feel alone. And I mean, before I met my husband, I am very lucky. My husband is wonderful. My late husband was also wonderful when I got my diagnosis. We were thrown for a loop. My baby, my youngest child, was 4 months old. Yeah, and like I said, I had to have a double hip replacement. And after that, of course, I had to go to a rehab facility to learn how to walk again. And I was there for 8 weeks. And it was a very long 8 weeks. But Toby brought my kids to me all the time. So it was good. But I just want you guys to understand that I understand. So a lot of understanding and communication. That's what I want to happen here. You have a place to go where you're not alone and somebody's listening and you will be heard. No judging. No judging. Your questions will be answered. If I don't have the answers for you right now, right here, I'll find them. If I can't research it, I have a doctor who is wonderful, who answers my questions. That's the other thing I also want to discuss is finding the right doctor. It took me a while to find the right doctor. I had to fire a couple, and it's okay to do that. I want everybody to understand that. You can fire a doctor. That is your right as a patient. If you feel your doctor is not listening to you, you can fire your doctor. There's more out there. I know it's hard. Like, I live in central New York. right before heading towards the hills in the North Country. And I know up there it's hard finding doctors just because it's so rural. We were looking at moving, and that was the basis of our moving was going to be circled around doctors and hospitals. You know, so you have to be careful. You know, decisions you make sometimes have to be all about your health. You know, and how it impacts everything. And it is your life from now on. You know, if you're newly diagnosed, if you're an old hat at this, like me, you know that already. You know, I need a sip of my Canada Dry Zero Sugar Ginger Ale. I should be the spokesperson for this stuff. I live on it. I don't have a gallbladder anymore, and I get indigestion all the time. It's not fun. I'm going to take a break, and I'll be back.